Good morning, everyone. I appreciate you guys being here for our kind of back-to-school news conference. I also appreciate everyone's patience. Once again, we find ourselves kind of in a summer of changes, of last-minute changes in our ecosystem and the world we live in that we're having to adapt to. Dr. Greene's going to speak to all of that with an opening statement, and we have several colleagues here from the district to be able to fill in with any questions you have. Our main goal here is to let you guys leave with all your questions answered for the beginning of the school year. So you have a list. In addition to Dr. Greene, we have Paul Soares, our Assistant Superintendent of Operations, available, Paula Renfro, our Chief Academic Officer, Vicki Schultz, our Assistant Superintendent of Human Resources, Corey Wright, our Assistant Superintendent of Accountability and Assessment, Elizabeth Trizotto, our Director of Nursing Services. I'm here, and also joining us today is our Chief Technology Officer, Jim Culbert. He was not on your list. That's Jim, J-A-M, Culbert, C-U-L-B-E-R-T, Chief Technology Officer. So with that, it's my pleasure always to turn it over to our Superintendent, Dr. Greene.
Good morning. It was my sincere hope that this news conference would be more about getting back to normal, about recovering what was lost in the previous COVID-impacted school years. Instead, this news conference is more about the new normal than the old normal. The 21-22 school year begins with a season of changing and pivoting in response to a virus that has not released its grip on our academic mission. But something much closer to normal is well within our reach as a community. Our schools, our teachers, and our students need everyone eligible for vaccination against COVID-19 to be vaccinated. I implore everyone on behalf of the children of our community and the teachers and staff in our schools, please get the shots. A vaccinated populace is our best strategy for giving today's children the kind of school experience we all want them to have. While vaccinations are clearly the gold medal strategy, face coverings get the silver. Our elementary students and some of our middle school students are not eligible for vaccinations. Face coverings are the best way for them to protect themselves and protect others around them, including our educators. I challenge all of our families to the simple act of kindness of having all children wear a mask covering for their protection and the protection of our teachers, staff, and other students. Last year, our main goal was to implement strategies to keep schools open and students engaged. With few exceptions, we were successful. Now, this year, that is our same goal. But this variant of the virus may make it even more challenging than last year. While our students did as well or better than students around the state last year, the learning loss experience as a result of the pandemic cannot be ignored. To succeed academically, we must have our students in school, and that leads us to our broader response to the pandemic. Within the latitude we have, we will work to make our school environments as safe as possible to keep our students in school as much as possible. So I'd like to share our strategies. Number one, as stated, we will strongly encourage all students to wear face coverings on buses and indoors. We will require employees to wear face coverings at least through September 3rd. Daily cleaning and disinfecting of high touch points will continue. We will continue to spray surfaces with an antimicrobial protectant treatment. We will have staffed isolated rooms for students exhibiting COVID-related symptoms. We will be implementing temperature checks, again, for elementary students only. We will emphasize hand washing and use of hand sanitizer. We are hiring additional nursing staff and school health aides to support every school. We are implementing free telehealth services with parental consent to give students access to health care. We will continue to use classroom and school bus seating charts to assist the Department of Health with contact tracing and to minimize quarantines. And beginning on the first day of school, we will again publish the dashboard displaying reported COVID cases impacting our schools so that parents can fully understand how the pandemic is impacting their schools of interest. I want to reiterate that all of this is designed to accomplish what we would be accomplished if every eligible person were to be vaccinated. We want to spread the vaccination, not the virus. To accomplish that goal, we are working with the Department of Health to establish a vaccination clinic in every secondary school beginning August 18th for students and employees to be fully vaccinated in the first quarter of the school year. 2021-22 is starting off to be another extraordinary school year as we continue to adapt to the pandemic ecosystem. As we have demonstrated since March of 2020, Duval teachers, Duval school leaders, Duval staff are incredibly resourceful, adaptable, and committed to serving students. We are prepared, and beginning next Tuesday, Team Duval will do everything possible despite all the constraints and challenges we face to provide our students with an outstanding educational experience even in the midst of a global pandemic. At this time, I'd be more than happy to take questions.
Dr. Greene, in your opinion, do you think the governor should rescind his executive order which bans mask mandates? You had mentioned that that would have been your preference absent that.
My concern and my battle is with this virus, and I need every resource to help mitigate that virus and spreading in our schools. My issue is not with the governor, it's with how can we keep our students safe. And if I can get our families to commit to wearing masks on buses and indoors, that is a strong strategy that we can use to support all of our students, especially at the elementary school level. Again, the vaccinations are available for most of our students in secondary schools. The challenge of doing temperature checks for over 3,000 students is a difficult one. We did it last year. But again, elementary students are the one group of individuals who do not qualify for a vaccine.
And Dr. Greene, are you planning to ask for vaccination proof from students or teachers, or is this going to be based on the honor system?
This is still based on the honor system. We will be offering vaccinations for our employees actually starting tomorrow.
We've been hearing from a lot of parents and teachers who really are pushing for the school system to defy Governor Ron DeSantis when it comes to the face masks. What would you want to tell them? I know we kind of a little bit already answered it, but what's just your message?
My message right now is that we are strongly encouraging everyone to wear a face covering. And I believe in our community. I believe in our educators and our families. And I'm strongly encouraging them to coalesce around this. We have a mask mandate for our employees through September 3rd, and I'm challenging our families to do the same thing.
Has there been any conversations or is there any contingency plan to bring back Duval homeroom as an option if COVID gets way out of hand?
At this time, remote learning options are not available. We have DVIA, our virtual school, and many families have taken advantage of that. And I want to let families know that that option is still available until August 9th. So if they're considering it, they need to sign up for Duval Virtual School. However, our teachers will have their team pages set up because we may have to deal with classroom closures, and they know that they would convert over to what we call Duval homeroom. Yes.
Specific thresholds that you have in mind in terms of moving to only virtual school for everyone or for specific classrooms, or is it kind of like case by case?
We have a threshold for closures, and it's in conversation with the Department of Health. They're really going to lead us in that decision when we would close a classroom. We also have to review the executive order because it talks about school closures in that executive order. Again, we're going to do everything possible if we need to quarantine a number of students. We are going to follow the lead of our Department of Health.
Dr. Greene, right now, what percentage of Duval County Public School staff is vaccinated?
We do not keep that information because they were not required to report. But we do believe a large percentage of our staff, our educators, are vaccinated.
And we know that the past year, it was a trying year for teachers, staff, everyone. Are there concerns about how many teachers didn't come back from the last school year? Are there going to be enough teachers and substitutes to begin this new school year?
We are concerned because this variant definitely has been moving through not just our community, but communities across Florida very quickly. And right now we don't know what impact that's going to have, but we maintain an eye on our vacancies. We maintain an eye on how many employees have to be quarantined. So yes, it is a concern, but we believe that our team has backup plans to support our schools and ensure that students are receiving a high quality education. Yes, ma'am.
What's the thought process behind having staff required to wear masks just for a month?
The thought process is that we want to open school up in a as strong manner as we possibly can. And getting through Labor Day is a challenge pre-pandemic to ensure that we have all of our students in place, our teachers are in place, our schedules are aligned. And because of the executive order, it does not address with employees. We have unions that we work with our employees, and I want to give a shout out to especially DTU and our unions for being collaborative and supportive of this 30-day mask requirement.
Can you talk a little bit about transportation? I understand that there's significant driver shortage, and there's, I understand, some expansion of routes as well on the part of drivers. How is that working this year?
Actually, that is just a normal process when we do have a shortage of drivers, which that is a national issue, statewide issue. Many districts are indicating that they're having a driver shortage. So when you have that impact the routes, you have to adjust the routes. Again, we're going to highly encourage that students are wearing their mask when they're riding on a bus.
And can you also talk a little bit about the notification process? There were some concerns last year about the speed at which the notification was getting out to families, and the process had changed a couple of different times. Can you talk about how it's going to work this year?
The Department of Health, that is under their jurisdiction of notifying families that may have been exposed to a positive case of COVID-19. They have their process of contact tracing. We will support them in developing the what they call the chart line that gives them the information of who possibly could have been in contact with an individual. But it is the Department of Health's responsibility to notify those families and determine who has to quarantine.
How many students will be returning to brick and mortar, and do you have a number on how many just kind of left or went to go do a different virtual school?
We have not finalized those numbers. We actually do not finalize that information until somewhere around the 10th or 11th day of school. But based on the preliminary information, the vast majority of our students are returning back to brick and mortar. Our Duval virtual school, pre-pandemic, the enrollment was less than 200 students. That has definitely increased, but we are prepared if the enrollment continues to climb. But I do not have final numbers at this time.
Dr. Greene, you mentioned bringing back the dashboard again on the first day of school. How often is the dashboard going to be updated?
The dashboard will be updated daily. It's a certain time in the evening. I'm not sure if it's 8 o'clock or 10 o'clock at night, but at either one of those time frames, it is updated so parents can check it daily.
Can you talk a little bit about how athletics is going to work as far as stadium capacity, and then also are there any requirements for coaches, teams, staff to be vaccinated or wear masks?
We have our protocols in place for athletics. It is very similar to last year. We're highly encouraging masks and encouraging students to, it doesn't matter whether you play athletics or you're in clubs or performing arts, we're highly encouraging all of our secondary students to be vaccinated because they are the most social individuals and want to be social, and we want to make sure that we provide an environment that they can get back as close to normal as possible.
How are HVAC systems doing ahead of next week, particularly at schools that are in the queue to receive new AC systems or repairs?
I'm going to ask Mr. Paul Soros, our Assistant Superintendent of Facilities, to come and address that question specifically. Thank you.
We're on schedule for completing HVAC work. Most of the projects we're finishing up last Friday. We'll have them done before the opening of the school year. We will set the AC systems to flush more outside air. We'll set them, we're going to change filters out prior to the start of the school year. These are recommendations that are consistent with ASHRAE, which is an agency that oversees air conditioning within all buildings, including schools. So we're taking those extra steps, and we don't anticipate the project's going to impact, HVAC projects are going to impact schools for the start of the school year. Hope that answers your question.
Are there going to be any changes to that sort of thing that were in place last year?
Currently, we are still working with our unions as it relates to COVID leave, so there is nothing at this time that is solidified.
Dr. Greene, will vaccinated students, will they have to quarantine if they're exposed to COVID?
Currently, the information we receive from the Department of Health is that if a student is vaccinated and they've been exposed to someone that has COVID-19, if they're not experiencing any symptoms, that they would allow them to return to school as long as they wear a mask for 10 days. That is the direction we've received at this time, and it's for student or employee. It's an individual.
Dr. Greene, are school dances on the table this year? Do we know about homecoming yet?
Yeah.
Probably a curveball.
Yeah, it's a little early. We discussed those events at semester. So at semester, I'm hoping I'm not having a press conference, but if I am, I can give you that answer at that time.
For the telehealth services you mentioned, that's brand new, and then can you explain a little bit about how it will work?
Yes, this year our board voted to implement telehealth services, and it is exactly what it is, that students can receive healthcare services from a medical doctor, and it's not only healthcare, it's also mental health virtually. Part of the program has a requirement that we have to have a medical trained individual facilitate those visits, and it must be with parent consent.
Will it be something that they have to sign up for, like a pass?
Parents, we will send home the parent consent, and parents have to sign that form that indicates, yes, my child can visit a telehealth doctor. If it's for mental health, then that's a very specific form. And once that information is received, if a student comes in, it doesn't have to be anything related to COVID. They can come in and say, I have an earache and my ear is hurting. That professional who is running the clinic would look up, yes, that student's parent said that they can visit telehealth. So we would call the parent, say, your child has an earache. We want to allow your child to visit the doctor. And it's an iPad that they turn, and then a doctor comes on and they will talk with the student about what are the issues, and they may end up needing to call the parent, or if the parent can be a part of the visit, then the parent can participate as well.
What are your projections as far as truancy? I mean, last year we started out with like many students like not showing up. What are the projections, and what are you seeing as far as that?
Well, actually, we have a team called the ART team that has worked all summer going out to locate students that were not in our schools last year. And I'm pleased to say that they've recovered almost 1,200 students re-enrolling back into our schools. It definitely will be one of our priorities and challenges we will face, that we are working with community partners to help us ensure that once enrollment is just the first step, keeping them enrolled will be the big challenge, because what we're finding is that the vast majority of these students are homeless by our definition of homelessness.
Can I ask Mr. Colbert about Duval Flex and that program and process being started, or whoever?
It would be Mr. Corey Wright, Assistant Superintendent of Research and Assessment, to answer the question about Duval Flex.
Sure. Duval Flex is really a opportunity for students to take individual courses while still assigned to their current school of enrollment, similar to what students may do for an additional course with Florida Virtual School. So it's just housed under our Duval Virtual Instructional Academy and allows opportunities to take additional courses here or there, or maybe for homeschool students to take courses through our online platform. So it's an opportunity for students to gain additional credits or just experience a different type of class through the virtual setting.
I also wanted to ask about disciplinary incidents and reporting the incidents there.
Is that related to Duval Flex?
No,
Oh, okay. I was like, I don't know. Okay. Our school police department is under new leadership. Chief Greg Burton is the new executive director of school police. We have had a workshop with the board. Our administrators have all been fully trained in SESR and SESR reporting, and those incidents that fall under that category that are required to be reported to law enforcement, that is what they will do. They will report it to law enforcement. Law enforcement will make the decision of whether that's a crime, not a crime, but they will provide a CCR number to ensure that we have the correct documentation that reports that we have reported the incident to law enforcement, and law enforcement has responded.
Dr. Greene, based on the number of students you're expecting to come back now and the amount of staff you're expecting to come back now, what would be the ratio of students to teachers for this school year?
We do our very best to follow the state guidelines on class size, the class size amendment. And so far, even last year, we met the class size amendment, ensuring that students in grades pre-K to 3, 1 to 18, students in grades 4 through 8, 1 to 22, and high school students 1 to 25. And the goal is to average those numbers. And right now, we're probably a little bit above that average, but again, we need 10 days of school to occur, because students may be registered, they may have moved over the summer and they've not withdrawn from their school. And so the first 10 days of school are very important. It gauges which students are in our schools and which students do we need to figure out, well, why they say they're enrolled, but yet they've not attended the first 10 days.
You mentioned that you're looking to staff
Our goal is to have either an RN, LPN, or a medical aid in every single school, and we have 157 schools. Today, we're probably at 80%. The medical aid was it's not a new position in our district, but we had not had one in every single school. And as we move forward, the goal is by the end of the first month of school that we have all of our clinics staffed.
Forgive me, is that a medical aid on top of a nurse?
No, it's one. It's either a nurse, an LPN, or a medical aid. The medical aids are more at the elementary school.
Some parents that we've talked to see vaccination and wearing masks as they shouldn't be required. It threatens their freedom. What would you say to those parents?
We are strongly recommending that students, if they're eligible, be vaccinated. If they're not eligible, they should wear a facial covering. Our goal is to ensure that every student has an opportunity for a high quality education and that they can do it in an environment that they feel safe, and that we've done everything as an organization to ensure their health and safety.
Dr. Greene, on the flip side of that, what's your message to families who are concerned about the lack of mask mandate?
I think I would say the exact same statement, that we are highly encouraging everyone to wear a facial covering. Our goal, again, is to ensure that they can receive a high quality education, and that as a school district, we've done everything to mitigate the spread of the virus, that we've put everything in place that we are by law legally allowed to put in place, and that we are committed to finding any strategy that would mitigate the virus spreading in our schools. Last year, we did a tremendous job of not having school spread, and worked really hard to ensure that that didn't occur in any of our schools. And we may have had one or two schools where it occurred. We dealt with it, and those schools were able to move forward.
In that same vein, I mean, we were all here months ago when you had said that off-campus activity was the very likely cause of a lot of the school-based outbreaks that we were seeing. In example, Sandalwood. What's your message heading into this year about that?
My message is still the same. You need to be safe whatever activities you're engaging in. If you're indoors, we highly encourage you to wear a mask. Implement social distancing. We've kind of stopped talking about social distancing. In our schools, our desks will be 3 feet apart as it is recommended by the CDC, but we're also saying when you're not in your classroom, you need to work to be 6 feet apart, and wear your face mask when you're indoors. Do all the things that I listed in my statement at the beginning. Keep hand washing, sneeze into your sleeve, not out where other individuals can be exposed. So it really is about everyone taking responsibility to not only keep themselves safe and healthy, but to be cognizant of the people you are surrounded by.
And last year there was an operational matrix, which was the quantity of students who would test positive or quarantine at a classroom level and a school level and a district level. Is that same game plan in place?
That matrix will still be on the website. It may have some adjustments we've made since meeting with the Department of Health, but yes, we will still have a matrix. It's a simple statement that the Department of Health will be able to, if I'm not sure the exact verbiage, but override any of the matrix if the matrix said it took 2 cases and they feel like this one has spread enough, they have we're going to listen to what they're telling us and move forward.
Dr. Greene, last night medical professionals hosted a webinar for parents answering questions about mask wearing. Some of them went as far as to say that a recommendation wasn't strong enough, that there needed to be a mandate to keep kids safe. Do you have a response to that?
again, as parents share their views with me, many parents share their views with the Department of Education. They share their views with the governor. We have been given an executive order that will dictate what we can and cannot do. But I am still able to strongly recommend, I'm still able to model the behavior that I hope to see in my employees and what I hope to see in my students. And so when I'm indoors and I'm not able to social distance, I put this on. And I'm fully vaccinated. So I'm going to speak directly to my families that we serve in Duval County and ask them to do the very same thing.
We're going to have people separated at like lunch still, right? Like I know, for instance, an example in like La Villa, we had a lot of kids who were like even in hallways and such because they had to separate because of the lunchroom. We're still going to do that, right?
Yes, they still have to have a plan for social distancing during lunch.
Last school year, we saw students at 6 different high schools stage these walkout demonstrations, and they had there was talk that they were having some sort of dialogue about Black history in the curriculum. Were there any changes that came out of that, or any differences in the curriculum this year?
The only difference is our African American studies. We were able to find resources to support our African American studies course. There's not been any change in anything outside of that.
Dr. Greene, earlier you were saying that there is concern around the number of teachers coming back and having enough substitutes. You told me there is a backup plan. Can you go into a little more detail about what that backup plan is?
Yes, that backup plan is the same one we used last year. Our district is fully committed to supporting our schools, and there were times that district personnel went out and subbed. Curriculum department under the leadership of Ms. Paula Renfro, specialists went out to support classrooms. Under chief of schools, we have personnel that can go out and support classrooms. And so we will use the same plan that we used last year.
The specifics you mentioned about the Black History course, can you say what years those might be offered in, or what sort of how that's?
Our African American Studies is offered at high school. It is either a year-long course or a semester course.